You can see this is jugular groove, and that's where my mass is. So I have to be really careful what I cut and what I ligate, and hopefully we won't have catastrophic hemorrhage. This distinguished gentleman behind me is Mr. Pooh, P-O-O-H, Pooh. He is a young donkey. We believe he's under a year of age, and he has at least 5, but possibly more pedunculated bleeding masses. We don't know if they are benign or malignant, and we don't know how invasive they are, but we do know that they are highly vascular. So this is gonna be a very challenging surgery. We're gonna have to prep multiple locations, so he's gonna be under anesthesia for much longer than our normal procedures are. He also has not been handled at all. He's not halter broken. We had to use our hydraulic squeeze chute to safely gain access to him before, but these masses are so severe and bleeding and covered in flies that we're not willing to wait for Corey to get more time being hands-on. So our plan is to put him through the hydraulic chute. We're gonna assess those masses more closely because we haven't been able to do a very thorough hands-on exam at this point. And then we're gonna do our very best to remove all of the masses. We're gonna send some of them off for histopathology to see if we can determine criteria of malignancy, whether they're benign or malignant. My biggest concern is bleeding and blood loss. He's a little guy, he's young. His CBC chemistry shows that he is stable enough to be an anesthetic candidate, but he's not all the way normal. So we didn't feel comfortable waiting and putting this off, so there are a lot of inherent risks. Our other big concern is the masses that are up underneath his jaw. There's a lot happening in the throat area, and there are a lot of major blood vessels up there. We don't know how invasive those masses are until we get in. So we are praying that we are able to safely remove those and that we have enough tissue to close afterwards, but there are a lot of question marks with this guy. I am about to give xylazine butorphanol. He's had dormosidane. He's relaxing. This is our anesthetic pre-med, and then we're gonna induce 10 minutes after that. We are clipping and prepping around these masses. They smell pretty terrible. We've got a lot of evidence of infection in here. You can see they're pretty vascular. I'm starting to remove this one down here because it's gonna tell me about the blood supply and what we're dealing with. The masses up underneath the jaw are much, much more complicated. So I'm using this spot to kind of give me a better idea what to expect before I'm up there. This one actually is quite close to both the carotid and the jugular. So our major blood vessels run right here. You can see this is jugular groove, and that's where my mass is. So I have to be really careful what I cut and what I ligate, and hopefully we won't have catastrophic hemorrhage. So we're wearing sterile gloves. Obviously, this is a field procedure. We always try to be as sterile as possible. But because this donkey is in quarantine, we're doing his surgery up here, and we're gonna work with what we can. I'm probably gonna spray all of you with blood. Just, cool. It's probably gonna happen. So I'm anticipating that there's gonna be one really big major vascular stalk area, and I'm gonna have to ligate those. But while we're working on the minor stuff, we're just trying to hemostat them. Woohoo! First mass is off. First mass is off. Yep. Went really well and pretty straightforward. We had 4 vessels, but we didn't have a giant stump, which is awesome. So I'm gonna get this one closed up. This guy's really difficult to handle. So unlike a very tractable horse, we're not going to be able to readily do easy bandage changes without heavy sedation.
What's the plan with the masses?
We're going to put them all in freezer bags and put them all in our cooler and try and pick one that's the most representative and hopefully send it off for some histopathology so we can see what, if anything, these are.
So we have a little bit of oozing, but we don't have like catastrophic ongoing bleeding. So we're going to close this subcuticular and then we're going to close skin. I'm most concerned about those masses up underneath his chin. So we got to get through this as quickly as we can. So I just did subcuticular. I'm doing horizontal mattress. You want to squeeze in here and give that? Here's our best access, I think, right now. Dr. Gina, will you trade with me and finish closing this at your convenience? I'm doing a horizontal mattress. There is some, I would say, mild hemorrhage that I feel okay with. But we'll keep having some blood kind of ooze out, and that's okay. I'm gonna do the one closest to the nose first. This mass is a lot more vascular, so I think that we are gonna take a little bit longer than the first one, which is okay. So after we're done and closed, we'll pull a sample for CBC.
Briefly talking about suturing, it depends on what tissues you're suturing. There's multiple different layers. Like in a spay, you have certain sutures that you do, and skin sutures like this, there's other kinds that you do. So Dr. Lydia did a subcuticular, so she went through the actual skin, like below the epidermis, to close the two layers together like this, so they'll heal together. And then you close the skin incision on top of that to keep pests and to reduce infection and things like that. And there's different kind of suture patterns that you do depending on what tissue layer you're doing. And she did horizontal mattresses, and that's a tension relieving. So some suture patterns that we do are not tension relieving, but she wanted that here because that skin's gonna swell. So it's really important for healing, skin opposition, infection reduction, and things like that. So it's really important that we get those tissues together. You don't really want to crank down on the skin because you want it to heal and be vascular. And if you crank down super hard, then you'll kill the skin. So that's why she liked the vertical and horizontal mattresses depending on which way your incision goes. I am holding off where we just removed that first mass from to try and reduce the amount of a hematoma that will form. I don't know how well I'll do because it's very dependent, but yeah, hopefully it'll keep it from being super painful and swollen afterwards.
You think these are sarcoids or whatever they're called?
Could be.
Do those grow back?
Sometimes.
Okay.
Could he have been born with these?
No. I don't think so. I almost have it all the way off, and then we'll check to see if we need to ligate any blood vessels, and we'll get it closed up and start on the next one. Second big mass is off. You can see how many bleeding vessels we had associated with this mass, quite a few. But so far, our total amount of blood that our patient has lost is acceptable. You did it! Fantastic job.
This third, number 3?
Yep. This was mass number 4, and it seems to be our very last friend.
So luckily, the largest masses that we removed today, the 2 out of the 3, were not as vascular as we were afraid they would be. So that's great. So the mass removal all went well.
We had 4 masses to remove from Pooh. The biggest one was like baseball to softball size. Dr. Gina took that one off. It was right up here underneath his throat latch. And he had another pretty large one a little bit closer towards his muzzle on the ventral midline. And then he had kind of a big one right on his chest. That one bled the most. It's the one I took off first. And then he had a little tiny one kind of between his front legs. So all of it went relatively well. He handled anesthesia pretty well. The surgery took us close to an hour, so normally we're done in 20 to 30 minutes, and we had to give him some top up. So he handled anesthesia really well. He's waking up well. His mucous membrane color looks pretty good. We're running a post-op CBC, and we're gonna check his values and make sure that he looks okay. We did not castrate him today. We did find that he had 2 descended testicles, but he did lose some blood, and we did a lot with him, and we didn't want to prolong anesthesia any longer than we needed to. So we are gonna have him recover and wait until he is fully healed and we have the results back from that histopath test that Dr. Gina talked about before we schedule his castration. Dr. Gina and I got Pooh's pathology report back this morning. He's so cute. He had 4 very large ulcerated masses hanging off his jaw and down his chest. So we were able to remove all of those masses in one go. And unfortunately, the histopathology report is not what we were hoping. He has sarcoids, which are a type of tumor. There are 6 types of sarcoids. Only one type is a malignant type, and that is unfortunately what the pathologist believes Pooh has. And the pathology report says there's an incredibly high likelihood that those masses will continue to grow and return throughout Pooh's life. Equine sarcoids are caused by exposure to bovine papillomavirus. So in addition to continuing to have really infected, bleeding, ulcerated masses that recur, Pooh poses an infectious risk to other animals. That type of virus can be transmitted by flies and in the environment. He did very well with his surgery, and those areas are healing, but the papers and predictions are that within 6 to 8 months, those masses will continue to regrow. So not the answer that we wanted with Pooh, and we were hoping that we would get him to adoption, but we don't want him to suffer or get worse and worse and have those tumors recur throughout his life. So unfortunately, because of the pathology results that shows that Pooh is unlikely to have a good quality of life and that he'll continue to have tumors grow throughout his life, Dr. Gina and I have discussed at length, and we've decided to recommend the last act of kindness. We don't want him to suffer.